All right. Good afternoon, everyone. Welcome. And thank you for joining today's webinar titled Introduction to the 2024 Governmental Public Health Job Task Survey, presented by the Public Health Accreditation Board, PHAB, and the Association of Schools and Programs of Public Health, ASPPH. My name is Liz Burpee, and I am the Director of Public Health Workforce Development at ASPPH. This slide contains the funding statement for the project we're going to be discussing today. And I'm not going to read through it, but I will say in a nutshell that the survey and the larger governmental public health job task analysis project, of which it is part, is funded through the Public Health Infrastructure Grant, the CDC grant, 5-year, multi-billion-dollar investment in our nation's public health systems. You might have heard of it. PHAB is one of 3 national partners for the FIG, and PHAB is contracting with ASPPH, and we are also working with the National Board of Public Health Examiners and BPHE to lead the job task analysis project, including survey efforts. I will not quiz you on any of that information today. Now, today, during our 30 minutes together, you will mostly hear from me, Liz Burpee, and Amy Belflower Thomas, Director of Research and Evaluation at PHAB. Kay Schaefer, Senior Research Associate at the Beaumont Foundation, is also with us to help describe the differences and complements between the Job Task Survey and the Public Health Workforce Interests and Needs Survey, also known as PHWINS, also being fielded this year. There are 2 more people I'd like to introduce that you may hear from during today's webinar. The first is my colleague, Frank Smith, there he is, lead for data architecture and business intelligence at ASPPH. Frank has been integral in putting the survey together. And Anthony Tibbs, ASPPH's IT help desk coordinator, and the real MVP of the webinar, also known as the person who will solve for any unforeseen technical issues. Brief overview of our agenda. Amy and I will take the first 10 to 15 minutes to provide an overview of the Governmental Public Health Job Task Survey, including what it looks like, how health departments will benefit from the results, and tips on how you can promote this survey among your colleagues. Kay and I will then briefly discuss the differences between the Job Task Survey and PHWINS, as well as how they complement one another, and we'll spend the last 10 minutes addressing your questions. A couple housekeeping notes. First is if you have any Zoom issues, please send a direct chat to Anthony Tibbs. Anthony, I'm assuming that your name is ASPPH Webinars. That is actually the name you will chat. And then finally, you may have questions come up as we're going through the presentation. Please direct your questions to the chat. Frank, my colleague, will be monitoring the chat throughout the webinar, and he will choose select questions to ask panelists during the final 10 minutes. If we are unable to get to all your questions, which is probably likely, we will create a frequently asked questions document and send it out to all registrants with this recording of the webinar. Great. I will now pass it over to Amy at PHAB.
Great. Thanks so much, Liz. Appreciate joining you guys today. Happy to be here. Want to give a little bit of background on the purpose of the Job Task Analysis Project and the steps we've taken to get to this point of being able to promote the survey and get it out to the field right now. So the overall purpose of the Job Task Analysis Project is to define governmental public health job tasks at entry, mid, and senior levels to improve workforce recruitment and retention at many different levels: state, tribal, local, and territorial health departments. You may have participated in a job task analysis before, or you may not have, but this is the first that we know of that's specifically to governmental public health. So it's a really exciting time in our field to be doing this. This job task analysis, as Liz mentioned, is part of the overall FIG, or Public Health Infrastructure Grant, workforce development efforts. So it's part of a wide range of efforts that we're doing both within FIG, but also complementary to things like Public Health WINS that you'll talk about later all to give us a better idea and better data and information on our workforce so we can take actions to improve our workforce and public health. And this job task analysis will be completed this year through FIG funding and again in 2027. So our first step in conducting the job task analysis was to form an advisory committee. The advisory committee for this project is comprised of 19 supervisor level managers from a selection of state and local health departments, comprising all 10 HHS regions. And a number of these committee members are with us today, and we really appreciate all their efforts thus far and in the future with this. In the second step, and with the help of expert psychometricians, the advisory committee identified 9 overall domains and 54 of the most common job tasks performed by the governmental public health workforce, again, at entry level, mid-level, and senior level jobs. So as much as we're asking you to take this survey and take a little bit of your time, they spent a lot of time working to get these domains together and the common job tasks to inform this survey. And so the next step is going forward from their great work. And step 3 is really to survey the full breadth of the governmental public health workforce to understand how frequently people perform these 54 identified tasks and how important they believe these tasks are to their jobs. Next slide. So let's talk about the survey a little bit itself. The survey opened on May 15th, so a couple of weeks ago, and it's going to remain open through at least July 31st. The survey again is broken into those 9 domains I referred to, with a total of 54 task-related questions across those domains. The domains you can see here are listed in this first image, 1 through 9, and include administration and support, communication, community engagement and education, direct services, emergency preparedness, response and protection, social and economic conditions contributing to health, information and data, policy and governance, and program planning and management. And if you look at this second image, you'll see a sample survey question on one of the 54 identified tasks. So in the survey, for each task, the survey will ask respondents to indicate the frequency with which they as an individual perform the task and how important that task is to their job. The survey also includes 16 demographic questions, including the type of health department in which the respondent is employed, their state or territory, and their job title. The survey is multiple choice, and we estimate it will take people anywhere from 10 to 30 minutes to complete. It's important that respondents complete questions in each domain, even if they don't believe that domain pertains to their job, because we want to get the full information on each individual who completes the survey. Because the job task analysis covers the entire breadth of governmental public health workforce, we are interested in hearing from everyone working in state, tribal, local, and territorial health departments. And so just to make this clear, because we know saying that you're an employee of a health department sounds really simple, but it can be really complicated. We are defining this as people can take the survey if they are, number 1, a contractor providing third-party services to a health department, a permanent staff member employed directly by a health department, an intern perhaps employed directly by the health department, a federal employee only if they're detailed specifically to that health department, or temporary staff employed directly by a health department. So we think these classifications are pretty clear for everybody, but again, you can always contact us if you have any questions about if you are eligible to take the survey or not. All right, back to Liz.
Thanks, Amy. So onto the deliverables, what is going to come out of this? Once we analyze the survey data, project partners will work with the advisory committee to develop a final list of governmental public health job tasks at those entry, mid, and senior levels. We will also develop reports on the aggregate results, as well as report on results by different strata. For example, folks from a specific geography, type of health department, job type. And the list of job tasks and these reports will be publicly available. Finally, for state health departments, you will receive the aggregate results for your whole state, as well as the de-identified results from your own state health department responses. Now on to the big question. What is the point of this? How will it benefit you at the health department? In general, results from a job task analysis can significantly clarify what members of a workforce are and should be doing to maximize their time and efforts. And we're hopeful that health departments will use the final list of job tasks to do a multitude of things, including, improve job descriptions, improve overall recruitment and retention, including more targeted recruitment based on what people need to be doing in their work, develop performance management plans, and match professional development opportunities with the essential job tasks as defined by the results. And additionally, you'll see the academia portion on your screen. ASPPH is a member organization of schools and programs of public health, right? We are going to take the results to our membership and plan on working with them to ensure that what's being taught in MPH and DRPH programs match with the actual needs in the field, what people in governmental public health do on a daily basis. We think that's pretty significant, and we hope you do too. A brief approach to surveying. We're not going to get too in-depth with methodology here, but in general, we're using snowball sampling. So this means that we are counting on you as health department leaders, health department staff, to spread the word to your staff and colleagues. We're also hoping that your staff will ping one another and encourage each other to take the survey. Okay. This is probably my most important slide. And I am no good at watching or listening to webinars. So if you're like me and easily zone out, please perk up for this one slide. If you take just one thing away from this webinar, other than the importance of the survey, it's how you can help promote it. We have a number of readily available tools to make it really easy for you to spread the word. Right now, Frank is going to drop the link to our survey website in the chat. This is really the one-stop shop for you to take the survey. There are survey FAQs. There's also a communications toolkit. And the toolkit has sample language that you can easily cut and paste into an email for your staff, as well as social media posts. We are also working on getting a memo into this toolkit, a memo for health department or health officials, in case you are somebody like a workforce director or another person with access to the whole staff and you really, it's your job or you really want to promote it. This memo would help you get the buy-in of your leadership. And another thing, you'll see a check mark next to the third item down, boxes with promotional materials. Some of you on this call probably have those in your office right now. If you're a workforce director for a FIG-funded state, big city, or U.S. territory, you should have received a physical box via snail mail from me, Liz Burpee at ASPPH, with materials to help promote the survey physically to your staff, such as flyers with a QR code linking to the website and the survey, posters and stickers. If you have not received that box, again, if you are workforce director at a FIG-funded health department, please note that in the chat. We'll see other ideas on the slide. One tip that we have to encourage participation is to carve out about 20 to 30 minutes in your next staff meeting for colleagues to take the survey in real time. And if you have more tips on what has worked for you for this survey or other surveys, please, please, please write them in the chat. My final plea is for the final list of job tasks to be accurate. We need people representing a diversity of geographies, health department types, and jobs to take the survey. So we need your help promoting in your own health department. And we are also acutely aware of the difficulty in getting the word out to small, rural, and/or tribal health departments, as well as encouraging staff such as frontline staff to participate amongst just the total busyness of their jobs. The results that we get from this survey will ultimately benefit health departments. That's the entire point. So we're asking you to help us help you, if that makes sense. So please spread the word in your health department, as well as talking to your colleagues across your state and anyone else you know. All right, this is our last slide before we go into the question and answer section. This is a side-by-side of the Governmental Public Health Job Task Survey on the left and PHWINS on the right. And many of you are likely familiar with PHWINS, the Public Health Workforce Interests and Needs Survey. Both of these surveys will be fielded this year at different times, and you will likely be asked to encourage your staff to take both. Both surveys are very important to our field on their own, and together their results have the potential to significantly strengthen governmental public health. So we are fortunate to have Kay Schaefer from the Beaumont Foundation with us today. And we've crafted this slide together to show how both surveys are different yet complementary. So I'll read the left and then I'll pass it over to Kay. For the job task survey that I've been discussing, right, we're fielding it from now through the end of July, and the focus is on employees' current tasks. We believe this will help health departments with recruitment through things that I mentioned before, creating better job descriptions, onboarding, more targeted performance evaluation. It will help in the training of public health professionals, including in academia before they get to the health department. For the FIG, the job task survey is part of its overall workforce development efforts. And in terms of sort of deliverables or data outputs, we're having those public reports, dashboards, and data files. Now I will pass it over to Kay, who will take a few minutes to speak about PHWINS.
Thanks, Liz. Good afternoon, everyone. And thanks to the Job Task Analysis team for having me today to speak a little bit about PHWINS. For those of you who may not be as familiar, PHWINS stands for the Public Health Workforce Interest and Needs Survey, and it's the first and only nationally representative survey of state, territorial, and local governmental public health workers. PHWINS is a census-style survey, which means that we survey individual employees at health departments across the country. We like to think of PHWINS as a snapshot in time of the workforce, and it aims to influence investments in workplace development, build the evidence base of training needs, and identify trends in attitudes, morale, and climate among the workforce. 2024 actually marks the 10-year anniversary of PHWINS, and the main focus of the survey for this fielding is on recruitment and retention, with the goal being to provide agencies with actionable information about their workforce's skill gaps and strengths, which can be used to inform succession planning and other strategic workforce development initiatives. So PHWINS can be used in a number of different ways, which are highlighted on this slide. And that also includes for PHAB accreditation, specifically for Domain 8 around training needs, as well as for FIG reporting around workplace satisfaction and diversity, equity, and inclusion. And finally, in terms of what we are going to be giving back to the field and to individual agencies that do participate in PHWINS, agencies will be able to compare themselves at the national level through our PHWINS dashboards. We produce two types of dashboards. The first is a publicly available dashboard, and you can see what that looked like in 2021 if you go to phwins.org/national. And we also provide agencies with agency-specific dashboards. And these are just for your agencies. They are password protected. And they allow you to benchmark yourself against the workforce nationally. So PHWINS will be in the field just after the job task survey from September of 2024 through January of 2025. And not to get too into the weeds, but just one difference in sampling that I do want to highlight between the two is that unlike the job task analysis survey, where there is one link and you are encouraged to share it with folks, for PHWINS, we provide every employee with an individual link to the survey. That allows us to track response rates more accurately and helps us when we are cutting the data in different ways to assist with technical assistance requests. So we actually ask that you do not share your links with your colleagues, but do encourage them to take the survey as well. I'll also note that PHWins is free of cost, and that part of participating in PHWins is that we at the Beaumont Foundation are able to provide you with ongoing technical assistance for any questions that you might have, which aren't covered by or you're not able to figure out on your data visualization dashboards. So yeah, I will pass it back over to Liz, and happy to answer any questions about the two surveys in a few minutes.
Great. Thanks, Kay. So now's the time we're going to take some of your questions that you've been putting in the chat. And just a brief reminder that whatever questions we don't get to in this portion, we will write in an FAQ and send it out to all of you in addition to the recording. I'm going to stop sharing my screen. Great. Frank, what is the first question?
All right, I'm organizing how to get through these, but the first question is, are these slides going to get sent out? And I guess I would refine that question and say, will people have access to these slides?
We can send the slide out with the recording.
Okay. All right, next, I'm sorry, but I'm going through these in real time. We have a question. If you want your help, I'll just reread the question to the group. Okay. If you want health departments to use these results to craft position descriptions and for academic partners to update curriculum, are you only asking what people are currently doing, or are you asking what people should be doing?
We are asking what, here, let me go back to the slide that Amy described. I'll share my screen. Here we go. So if you take a look on the right side, these are the questions that we ask in addition to demographic questions. Frequency, how often do you perform this task? And then importance. So I will, I think, be able to deduce the answer to that question. Like, what should you be doing if you're not doing it? By, if you say, for example, I never do this task, but it is very or extremely important to my perception of what my current position is, that is a really good data point. Does that make sense? Amy, do you want to add anything there, or Frank?
I would just say that kind of one of the points of the advisory group that met and developed all this was like to figure out, like, in the field right now, what should be being done. So you can almost think about the survey as the should, and now we're asking you, what are you actually doing? So we can figure out where the gaps are. Might be a simplistic way of thinking about it.
Is there another question, Frank?
There's a few, so I'm just trying to figure out what we can get to with time remaining.
Sure.
I'll paraphrase this one, but what can people do to encourage responses to both the GPH JTA and PHWins?
Great.
I can hit this a little bit, Liz. And I think this may address some of the other questions I saw too, Frank. We definitely understand the feeling in governmental public health about being overassessed and having to take tons of surveys. We are well aware there are the profiles out there, both NACCHO and ASTO, and there's public health wins, and now we're adding this JTA to it. We're being really intentional with our big evaluation of infrastructure to use and utilize as much of the existing data that you provide through all the surveys, the existing surveys, as much as we can to develop, questions to then see gaps and do more evaluation around. The JTA itself is something that is different than all of those other surveys. It provides totally different information for the field. And so that's why we're fielding it now. And I saw some of the questions about, like, well, why this year? Why not next year? We do want kind of a beginning of FIG, end of FIG. So year 2 and year 5 is the best that we could do. And we worked intentionally with Beaumont this year to make sure that we are at least fielding the surveys in different times and trying to talk about the differences between the two. So I would say in general, we know you're over surveyed. These are really, really important though, and realize that each of these serves a different purpose, and altogether, all the different surveys, profiles too, that health department staff contribute to really give us this bigger picture right now in this historical investment time with FIG, we need all the information we can get to kind of figure out these next steps to really create impact with this infrastructure development. So I hope that brought a couple of questions together.
Yeah, and Amy, just to briefly add to that, we also know and agree no one wants to take another survey. But part of how I tend to talk about PHWINS is, really leaning into that census style approach, which is the same for the job task analysis, and that when you have other surveys in the field, like the ASTO profile or the NINCHO profile, that's one person filling out information about an entire health department, where for these surveys, employees get to have their voices heard. They get to provide their own feedback and share their individual experiences, which can be rare in this field, particularly for governmental public health. And then in terms of tangible steps that folks can take to encourage participation, in 2021, which was the last time we fielded PHWINS, we heard from our workforce champions, who are our points of contact at each health department, that one of the most effective strategies they saw was giving employees dedicated time at staff meetings to take these surveys. So both the job task survey and PHWINS are about 20 to 30 minutes. So maybe setting aside the last half of a survey to give folks that dedicated and blocked time to take the survey. We always welcome any other strategies that you see to be effective, but no one health, you've seen one health department, you see one health department, but across the board, this is really the one we've seen be the most effective.
Right. And I will add, for what it's worth, I took the survey myself. It's, that data is going to be scrubbed, but I used to work at a health department and did it thinking about that with that job in mind. And it took me 10 minutes, the job task survey. It will likely take people longer, but it's a the questions are very repetitive. And once you get rolling on it, it's pretty quick to get through.
Okay. We have a lot of questions. We're not going to get to all of them. I'll answer a couple that I noticed. One question was, how are local and state health departments involved in the creation of these surveys? I won't say that here, but if you go to the link that I provided in the chat, that will describe the expert panel that we worked with for the Governmental Public Health Job Task Analysis. So you can get that information there. But there was, to make it easy, in October, a bunch of us were in a room in DC from all over the country, putting these job tasks together, coming up with the domains. That's the simple way to put it, but you want more info than that. Amy, I'll direct a question to you. How will the JTA data be integrated into the larger national FIG evaluation?
Yeah, so it's being seen a little bit outside of the evaluation, and more of, we're seeing it move into really our training and technical assistance arm. So the reason we're seeing that differently is, yes, it's an assessment, so you normally think evaluation, but really the uses of this, what comes out of the job task analysis, we really see being really shared with our training and technical assistance partners at NMPHI and PHAB and ASTO, so that health departments and FIG recipients will be able to take the data that comes out of it and create tools and get training and get technical assistance on how to implement those and use those. So that is kind of the next steps, is once the survey comes out and it's analyzed, we'll be moving on to training our training and technical assistance partners to actually help recipients use this on the ground.
Great. Thank you. I'm going to end here. I'm going to show our very last slide. Sorry, please bear with me. Thank you for attending. If you have any questions, you can email me directly, eburpee@ASPPH or data@ASPPH. I will be the one responding to both. We hope you feel excited about the job task survey and what we hope it will provide the field, and that you have everything you need or will once we send out the FAQs to encourage your colleagues to participate. And please don't forget to take the survey yourself. Thank you, and be on the lookout for an email from us with this recording and other information.